Hello, friends. I'm your host, Sharath, and we are embarking on a journey onto health, well-being, and wellness in our one-of-a-kind show called Health and Healing by Dr. Saraswathi Kalvakota. Optimum health is a vital necessity for happiness, joy, and a productive life. Our subject matter expert, Dr. Saraswathi Kalvakota, will give us simple solutions and tips to ease around the most elusive and crucial diseases, and will throw light onto how to conquer pain, stay fit, and take away home some insights and eye-openers to achieve wholeness and well-being. Dr. Saraswathi Kalvakota is an internal medicine and pediatric specialist and assistant clinical professor at Wright State University, Boonshoft School of Medicine, Dayton, Ohio, USA. Dr. Saraswathi Kalvakota is also a board-certified pediatrician and internist associated with the Wright State University faculty as an assistant clinical professor, Dayton, Ohio. She is also involved in teaching clinical medicine, teaching residents and students who are in training to become physicians. She has over 30 years of clinical experience in primary care. Dr. Saraswathi is also a lifetime member of American Association of Physicians of Indian Origin. She has done a lot of community and social services and promoted health, hygiene, and preventive health services. So let me cordially welcome our doctor and subject matter expert herself, Dr. Saraswathi Kalvakota. Dr. Saraswathi, welcome to our show called Health and Healing. How are you doing today?
I'm doing fine, Sharath, and as you introduced me, it was the most elegant and most gracious way you have introduced me. Thank you for such a great introduction. I really want to thank you for that. I'm Dr. Kalvakota, and I have been in this field for a long time, as Sharath mentioned. And Sharath has done a great amount of work in bringing this health to you all, and it's wonderful efforts, and it required a lot of commitment and creativity. And no doubt, Sharath, he has those qualities. And with that, I am a team member with the Mana TV International channel, and with Sharath. This is a wonderful work which is created for your education, health related topics to understand and become aware and take care of yourself. So today's topic is going to be on heart and health, which is a very important topic because heart is the most important organ in the body. And if it doesn't work for a few minutes, the whole thing comes to a close. So we are going to launch a lot of difficult areas where a heart problem becomes difficult to manage, starting from the time it happens. So we will go in detail and we embark on these discussions with questions and answers. And I'm hopeful that at the end of this message, you will go home with a lot of important information so you can apply to your life for good health.
Thank you, Dr. Saraswathi, for acknowledging our show. I'm very sure our show will go into a lot of lives and change them as far as health and healing is concerned, as far as well-being and wellness is concerned. My first question will be, and my primordial thing, before we delve into any other question, Dr. Saraswathi, give us the statistics of heart disease?
That's the definitely first question to ask, and that's very appropriate. So to know everything, we want to know why we are picking this particular topic and what is the importance of this. The answer to that is to know how common is this disease, heart disease. So to give you the answer is the most common disease which causes mortality and death, mortality and morbidity or disability of your life is number one cause is heart disease. You take it in United States or you go to throughout the world, you take the statistics. It is number one cause of heart disease, number one cause of the death in diseases is the cardiovascular disease is number one. So being so common and having such a high incidence, we really need to know what we could, what is that we can do, because it is the reason for death, and we want to prevent that. And if we prevent that, we can go look at the root cause. So let's just give you a couple of more numbers on what it is. It's the leading cause, as I said. And we have in the United States, the studies show that 659,000 people per year, they die from this disease. And then there are $363 billion are spent on this particular disease because it requires that much economical support. And it's an extreme burden in the government to provide primary preventive and hospitalization care and post-op care and also long-term care. So it requires a lot of people involvement, a lot of health personnel care, personal recommendations and follow-ups. So it is a big burden for the government. So we really need to know the reason why we brought this topic today. And the last month, the February month, we had the whole month for discussions on heart health disease. Because the more we are aware, the more we recognize problem, the intensity and the statistics are going to plateau or hopefully come down soon over the next few years.
Thank you, Dr. Saraswathi, for telling us the statistics of heart disease and how much of a dangerous thing heart disease is. And that's why we are here to learn from you. What are those things which go unchecked and can cause disasters? Tell us the types of cardiovascular diseases.
Okay, so now moving on to a little bit more information in these heart-related problems. And this whole system is called cardiovascular system. So cardiovascular system involves the heart as well as the blood circulation, arterial blood circulation and venous blood circulation. So it is all lumped into one name as cardiovascular system. So, but most common cause of death is coronary artery disease, but there are several other causes related to this cardiovascular system. So let's go on a little bit more. So what are the other things which are also cause morbidity and mortality? Number one, as I said, coronary artery disease. Number two is any diseases related to valves in the heart that could be also causing quite a bit of morbidity and mortality. And then we can have a child born with a congenital heart disease. Some of them are taken care of, but later on, some of those valvular diseases or muscle diseases pop up later on, and that can cause heart disease. And there are instances where we have the muscle of the heart is affected. That means what you call that is cardiomyopathy, means only the muscle of the disease, muscle of the heart is affected, which has nothing to do with coronary arteries. So that can cause heart problems in the heart disease and then end up in morbidity and mortality. And then, as I mentioned, it's a lump, like a heart disease, heart and the cardiovascular disease. Vascular or the blood circulation going to the brain, they can have a blockage, and then they can have also a stroke in the brain, and that can be a very disastrous event, which can cause death or morbidity, long-term morbidity. And then when you look at some of the veins, and they also can cause blood clots, or they can travel to the heart from the distant organs in our body, and then that can lodge in the lungs, and that can cause also problems with either disease or the death, or with the morbidity, long-term morbidity. So these are all together, we call it heart diseases. That doesn't mean that they all at the same frequency causing the problems.
Yes. Yeah. As we discussed offline, you said that there are those 3 significant cardiovascular diseases which are predominantly killing a lot of people, and which have to be addressed with utmost importance. So tell our Mana TV International audience, what are those top 3 cardiovascular diseases?
Okay, this is a very important information, and it should be definitely a take-home message. Top 3. First one is coronary arteries, which supply blood to the heart. So it's a very important blood circulation. The blood is pumped from the left ventricle. Where does it go first? It goes to the heart itself, because it has to function first to give blood to the rest of the body. So that is where the problem originates. So number 1 cause of the heart disease is the coronary artery disease. And that is one. Second one is the cerebrovascular diseases, which cause a stroke. As I said, peripheral vascular diseases, arterial disease, which gives the blood circulation from the artery here, carotid artery, and that goes to the brain to provide oxygen to the brain tissue, brain cells, and that can be blocked. And due to several reasons, we call it as a thrombus, or it could be a plaque, and that can cause. So that is the devastating event, which is called stroke. And that is the second most common cause. And the third cause is the clots in the blood, clots in the venous system. So as I said, we have an arterial system, we have a venous system. So venous system function is to take blood from the extremities, distant organs, to the heart, where blood gets cleansed in the lungs, from heart to the lungs. So these are seen in the lower extremities, where the veins can be very weak. The valves sitting in the veins can become so weak, and they won't pump the blood as efficiently as they should, and then can cause some clots in the blood, and that travels to the heart and causing more problems. So we need to know these are the 3 things are most common, and we need to address these 3 things. I'm not saying that we should not address other problems. These are the most common, causing a large population. And this is, it affects the larger population. So my job is for you to know, become aware of these 3 problems. And if you know more of what causes is well and good, beyond. And I really like to appreciate you all. But I want you to take home, these are the 3 things which should be known and should be aware of it. Laymen, anyone should be aware of it, so they can take care of themselves, their loved ones, as well as their colleagues or community people, or anywhere, anytime where you see somebody is having problems, you can help them too. So that's the reason I'm emphasizing a lot on the how to recognize is a very important part of education, and that should be for laymen and people like you who are listening. And I want you to really emphasize on this so that you will take home this message as an important message.
Thank you, Dr. Saraswathi, for throwing light on the top 3 cardiovascular diseases, and I'm sure our viewers, are taking these points home and understanding, that at least you have cleared the air for the layman to understand what exactly is going on inside, and especially in the heart. My question is, in the light of understanding how deadly heart disease is, this is the question I got for some of the people I know. They asked me to ask this question.
Mm-hmm.
Is heart disease the leading cause of death in the world?
Yes, in the world as well as in this country too. It's across. There is some disparity into which country has more, which country has less. And that's the interesting statistics recently produced. Least incidence of heart disease seen in Japan, and highest incidence of heart disease is seen in Russia. And United States stands in between. Before that, United Kingdom, and of course, we have few other countries. In China, also urban China, rural China also fare better than this country too. So these are the Scandinavia. That is the next one, which has a better statistics too. So we don't have much on Indian statistics on coronary artery disease. I'm sure there are but I was not able to retrieve the accurate information. So without having my accurate information, I really do not want to give you wrong statistics. So they studied on those, why Japanese people have lesser incidence, why Russia has highest incidence, and why we still sitting in the middle means we still have higher incidence of coronary artery disease. The reason is the more Western the countries are, the higher the incidence of coronary artery disease. And that goes back to our lifestyle, the way what we eat, what we put in our mouth, what kind of activities we have. So these are 2 important factors, and what habits we have. So these are multifactorial at the root level, preventive level. So studies are proving over and over and over again that lifestyle modifications are very important, but we know that there are reasons and why the Japan is the lowest. So I like to go and stay in Japan because I will be forced to eat their food. So it is that important. And if we can bring that habits to us, lifestyles here, we can make a big difference.
So Dr. Saraswathi, thank you so much about telling the statistics of how heart disease is prevalent as far as the demographics is concerned, and how globally it varies from country to country, and what are the kind of precautions you have to take in different geographies also, and that even I was never aware of. So this will strike a chord in those who are watching as well, if they're traveling and things, and if they're eating something in a different country, and so that they can be aware of what can happen to them, and they can be more careful, and they can be more circumspect. So
right, absolutely. I see that. Good question. And before I answer that, I just want to bring the heart, how important the anatomy of the heart. As you all know, you probably know more than I explained right now. And my emphasis is not on this whole lot, because this is something everybody knows to a certain extent. So we have 4 chambers. One is right ventricle, left ventricle, right atrium, left atrium. And this heart, just think it is 4 chambers. And then each one has attachment to the blood circulation by having two main vessels. One is taking the blood out of the heart, pure blood out of the heart, and first then gets to the coronary arteries, and then it goes to the brain, and then it supplies rest of the body. Okay, that is the pure heart, pure blood going. Why? Pure blood is needed for the oxygen to travel to the smallest molecule of the cell. Okay, that is very much needed for the in every cell in our body needs oxygen. The only way they get oxygen is getting the circulation, the blood pumping the oxygenation into the each cell. So that is the arterial system. So that originates from the left ventricle. So the right ventricle brings all the blood and then takes it to the lungs. And this is impure blood. So, just a general picture. So the arteries, which is coronary arteries, is each artery, it is divided into two. Coronary artery is divided into two. So one artery gives the blood circulation to the left heart. Another branch artery gives the blood circulation to the right heart. So what happens is when there is a blockage, let us say it's like a pump, hose pump, water hose pump. If the inside diameter is clean, you have a good water coming out of and then from the fountain, and it aerates, it brings the water to the grass. But if the pipe is clogged, you see that particular hose where circulation is going, where the water is going, the grass gets dry. That means the water is not going. So when that happens in our human heart, when the blood is blocked and not going to the tissue, that particular tissue, muscle tissue, suffers from lack of oxygen. When that happens, the oxygen is not given to the particular tissue, and then either it starts malfunctioning or it may just die. So these are the critical areas where extreme alertness is needed when the symptoms occur, so that the patient does not get into complete damage to the heart muscle, whichever blood supply is blocked. So that is the anatomy. And it's good to know that there is something blocking, and that block is causing the problems. So you can connect it from your heart symptoms and what is happening. You can visualize it. So you can take immediate action. It may not be happening to you. It may be happening to your loved ones. It may be happening to your friends. So, you kind of go through a dry run, just like what you have heard, and immediately you start taking the action. And that's the purpose of me giving you explanation, what happens to the blockage when that happens, and how we look at the symptoms later, in next few minutes, so you can connect it. So the cause for the heart problem is there is a block from the plaque. Plaque is the cholesterol mass sitting in the lumen, and it starts building up slowly and slowly to the point where it completely closes 100%. Or it could be coming from a thrombus. It's a blood clot. And then it makes on the blood clot, the more and more cholesterol deposits takes place. And then it closes the lumen completely. Then there is a heart attack. So we know all these things. And when the blockage is not 100%, we can intervene on that. When the symptoms come, we can intervene on that. So I want you to connect, with me. I want you to stay with me in next few minutes, so you can easily connect to what I just said and what is going to be next. I'm going to say.
Thank you. Thank you, Dr. Saraswathi. Tell us about the risk factors involved in coronary artery disease and heart disease as such.
Okay. Very important. Now we are coming to the crux of the subject matter. And these next few minutes are very essential points, and you will be taking home these messages to help yourself and your surroundings, people who surround you. Why? What are the risk factors? Why the coronary artery disease is getting more and more in Western countries? Number one cause is, I would not say number one, but these are equally important causes. If there is a family history of heart disease, and that means anybody less than 55 years age or 60 years age, less than that, if they develop heart disease, that means it could be related to familial nature. Okay. Somebody has high cholesterol, they are at high risk. Somebody has blood pressure, high blood pressure, they are at risk. Somebody who is obese or overweight, they are at risk for heart disease. And then somebody who smokes cigarettes, of course, that is definitely a high risk for, because it promotes and potentiates the clot formations and vasospasm, we call it. So that's definitely a risk factor. And then there is people who have who do not want to do anything other than couch potatoes or just being home and sedentary lives. That's the risk factor. And people who have a high intense stress rate, stress levels, they are prone for heart diseases. So looking at all this, what we know is everything we describe can be altered. And that alteration can make a big difference into how your heart disease is going to be behaving, whether it's going to come 10 years from now, 20 years from now, or 5 years from now. Again, these are the studies we have, and this is where we are really stressing the factors to improve upon, so that we can have a better statistics coming up in the next 10 years. So I touched on all the factors. And another factor is that if somebody had a heart attack before, like 5 years ago, they're at a high risk for second heart attack too. So don't remember that, if the person is doing well and had a heart attack 10 years ago, he's fine and dandy. No, he still needs to continue that healthy lifestyle modifications and stay fit so that he will delay or he will prevent the second heart attack. So he can't just go and do everything what he did before 10 years after first attack. He still has to have the discipline into keeping that under control to a certain extent with these lifestyle modifications.
Thank you, Dr. Saraswathi, for throwing light on the statistics of heart disease, the demographics of heart disease, the types of cardiovascular diseases, and the risk factors of heart disease and coronary artery disease. So we'll be back in next episode to talk about how to save yourself, circumvent heart disease, what are the types of diagnostics, and there are different things, how to prevent yourself, guidelines and preventions, and much, much more to become heart healthy and love your heart. So we'll be back with another episode of Health and Healing with Dr. Saraswathi Kalvakota in episode 2. Until then, watch our series, subscribe to our Facebook and YouTube channel, Mana TV, and our live streaming, YUPP TV. Thank you.
Thank you, Sharath. Let's come back soon. And we have a lot more important points to announce and to talk about and discuss, because this is definitely halfway, and there are a lot more to talk about the heart diseases. And I'm sure and I'm very confident that the next session is going to be even more interesting and more educational. So friends, see you next week.